The second part of chapter 16, we're going to talk about classification and staging. There's a lot of complicated information, but I want to focus on the learning objectives was basically to be able to differentiate between malignant tumor and a benign tumor. And there's specific characteristics that I'll talk about. And then just briefly describe the staging and grading of cancer and the implications for treatment. So the staging and grading can be pretty complicated, and I'm going to talk about some different types of cancer, but stay on the path and don't get lost in the forest. And I'll hold your hand as we go through. So not all tumors are cancer. So tumors are classified as benign or non-cancerous. So this is not cancer. It's not cancer if it's benign. It can be precancerous, sometimes called neoplasm in situ or carcinoma in situ. So it's abnormal cells that could become cancer, but it doesn't mean that it necessarily will because maybe the promoters aren't going to be there to do it. But premalignant is more dangerous than benign, but it's still not cancer yet until it becomes malignant and then it's cancerous. These are those bad guys. These are the bad coworkers that can invade and destroy nearby tissues and may spread to other parts of the body. So benign tumors are not cancerous. The cells might be abnormal, but they resemble body cells, and some of them are still doing their job. They're not, they don't spread to other areas of the body. Where benign tumors can be dangerous is if they're in risky areas, hard to do surgery on, like the brain or the spinal cord, or they're large enough to really compress the surrounding tissue or obstruct a duct or something. That's where it could become a problem. Most of them are not fatal, and can be surgically removed. So malignant cancers, now the cells are getting weird. They're behaving abnormally. They're not doing their job. They can metastasize or spread throughout the body. They can break down blood and lymphatic vessel walls, and that's a great way to spread throughout the body via the circulatory or lymphatic system. And yeah, they're bad. Malignant tumors, not good. So benign tumors are usually differentiated cells, meaning they kind of have some normal function, but they reproduce at a higher rate than normal. That's what makes it a tumor. They're encapsulated, though. They stick together. They can cause tissue damage by compressing adjacent structures or be life-threatening in the brain, but otherwise, they're very treatable. Malignant tumors are the undifferentiated non-functional cells. They reproduce rapidly. They're abnormal looking. They usually don't do their job. They're the bad coworkers. They don't like to stick together. They're not cohesive, and they don't have any contact inhibition with other cells. So normally cells are like, I don't want to go over there. That's not my area. But malignant tumor cells are like, I'm going over there. I don't care what you think. So they can infiltrate and spread into surrounding tissue, and they can infiltrate the blood and lymph system and spread to distant sites. So not good. Malignant tumors lack control of mitosis and they don't undergo apoptosis. So they're dividing abnormally and they're not dying off the way they should. There's no normal organization or differentiation, so they're not doing their normal cellular job. There's no contact inhibition, so they will just invade other areas. There are abnormal cell membranes, altered surface antigens, and they don't adhere to each other. So they often break loose from the mass and invade other tissues. So malignant tumors, just like they sound, they're bad. They're the bad coworkers. So malignant tumor, the mass can compress blood vessels, leading to necrosis and inflammation around the tumor. They can secrete enzymes or hormones to break down proteins in cells and cause systemic effects. And unfortunately, sometimes those are called paraneoplastic effects. And unfortunately, that can distract the doctors from the real diagnosis. They can say, oh, there's something wrong with their calcium level, and they don't realize it's being caused by a malignant tumor until later. So malignant tumors cause inflammation and loss of normal cells, leading to progressive reduction in organ integrity and function. So it's not just the invasion, but they also like diminished function in the area. Angiogenesis is where tumor cells secrete growth factors to stimulate the development of new capillaries to feed the tumor. So that is not good. None of this stuff is good. They spread either by invasion or metastasis. So invasion is where the tumor cells grow into the adjacent tissue. Metastasis is where they spread to distant sites via the blood or lymph or other body fluids. So nomenclature, benign tumors have the tissue name plus oma, like adenoma for a gland with a benign tumor. Malignant tumors have the tissue name plus the suffix carcinoma, so adenocarcinoma. Tumors of connective tissue are usually called sarcomas, and they're often malignant. Several malignant tumors have unique names like Hodgkin's disease, Wilms tumor, leukemia. Those are all malignant tumors, but or malignant cancers, and they have unique names. So cancers are classified by the primary site where the cancer first developed. So if you say breast cancer, that just means the primary site where it first developed. Or histological by the type of tissue where the cancer originated. So that's like adenocarcinoma or sarcoma. So adenocarcinoma originates in a gland, and sarcoma originates in connective tissue. So when you're classifying by histological type, there are hundreds of different cancers, but they are usually placed into one of 6 categories. These are the 6 categories: carcinoma, sarcoma, myeloma, leukemia, lymphoma, or mixed. So there's the ICD-10 codes for all of them. So we'll just kind of briefly talk about each one. Carcinoma is from epithelial tissues, and this is 80 to 90% of all cancers. So adenocarcinoma, squamous cell carcinoma, those type of things. Skin is the most common, but digestive and respiratory tracts are also part of this group. So most of the carcinomas you hear about are 80 to 90% are carcinomas. Sarcomas, about 1% of all adult cancers, but 20% of pediatric. And when you say solid cancers, it means there's an actual tumor versus like leukemia or lymphoma, which are not considered solid cancers. There are more than 50 types of sarcoma, but usually it's either bone or soft tissue. And soft tissue is the most common type, but that's only 1% of adult and 20% of pediatric. And the few pediatric cancer patients I've worked with had sarcomas. So myeloma is plasma cells, they're arising in the bone marrow. So it's basically bone marrow cancer. Only 1.8% of all new cancers. Multiple myeloma is the most common, and it's found multiple places in the body, or a plastocytoma is a single mass. And I'm just telling you these to familiarize you with the different categories. Remember the learning objectives. We don't need to know this in detail. Leukemia starts in the early blood-forming cells. It's found in the bone marrow, mostly white blood cells. It's the most common cancer in children and teens, and about 3.7% of all new cancer cases. Leukemia can be sudden onset acute leukemia or insidious onset chronic leukemia, and it's the type of leukemia is based on the cells involved. So if it's the white blood cells, it's considered myelogenous leukemia, and if it's T cells, B cells, or natural killer cells, it's lymphocytic leukemia. So if you have acute lymphocytic leukemia, it's called ALL. Acute myelogenous leukemia is AML, and those are the most common types in children. And then CLL and CML are more common in older adults. Lymphoma arises from the lymphocytes or glands in nodes of the lymphatic system. Tons of different types of lymphoma, but they are usually 2 categories: Hodgkin and non-Hodgkin. So Hodgkin is 0.5% of all new cancers, and non-Hodgkin's is 4.3% of all new cancers. There is a type of cell that's called a Reed-Sternberg cell that is a diagnostic for Hodgkin lymphoma, and the presentation of symptoms is slightly different between the two. A mixed type, sometimes there's more than one tissue involved, and that's considered a mixed type. So adenosquamous carcinoma affects epithelial and squamous tissues. Carcinosarcoma affects multiple tissues. There's gastric mixed type carcinoma. So it just means, miscellaneous. It affects more than one type of tissue. So cancers are staged to explain the extent of the disease. So usually when you're diagnosed, they give you a staging. The staging doesn't change over time, so they never backstage you. So if you started at stage 4, you don't go back to stage 1 when you're getting better. So they're either usually as broadly, they're classified as solid tumors or liquid tumors. So liquid tumors are blood and lymph cancers, basically, and solid tumors, everything else, where there's an actual neoplasm. So the TNM classification is the most widely used system for staging solid tumors. And so T is the site of the primary tumor, or where the primary tumor is. N is the regional lymph nodes, and M is metastasis. So T is tumor, N is node, and M is metastasis. So I do want you to know that. So there's different combinations of them, and so I'll just give you some examples. There are certain areas that have different staging systems, like brain and spinal cord tumors, and then the blood and lymph tumors have different staging systems as well. So the purpose of staging is to determine the prognosis and guide the appropriate intervention. And so all the members of the healthcare team know what they're talking about. It's a standardized communication. So T tumor, N lymph node, M metastasis. So the example is it'll say T1, N2, M0. So T1 means you have one small tumor. N2 means 2 lymph nodes involved, and M0 means no metastases. So you can kind of get the idea. So if it said T3, N5, M1, you could figure it out. So those are the details of that. I don't necessarily expect you to know this level of detail, but there it is. And so whether you have it or not. So metastases are always going to be either it can't be measured for some reason, no spread, or yes spread. And then nodes is the number of nodes. Tumors is the number of tumors. So there's also, besides staging, there's also grading. If you have a lower grade, you have a better prognosis, and a higher grade has a poorer prognosis. So basically, it's what the cells look like histologically. So if the cells are really undifferentiated, it's worse. And if the cells are very differentiated and they resemble normal cells, then it's better. That's so just to make that simple. Stage groupings, it's a combination of ratings for the TNM for the primary solid tumor. So stage tumor is where you have carcinoma in situ. So that's that precancerous stage. Abnormal cells, but no cancer, but the cells could become cancerous. Stage 1 is the early stage, no cancer cells in the lymph nodes and no metastasis. 2 and 3 are cancer cells are localized, but they're invading nearby tissues. And stage 4 is there's distant metastasis. So pretty simple, hopefully. Blood and lymphatic cancers are different from tumor-forming cancers. They don't produce tumors. They disrupt the circulation. They affect oxygen and nutrient supply to the entire body, and they impair waste and fluid removal. So leukemia is blood cancer, and lymphoma is lymphatic system cancer, and they're different types of each. So for leukemia, they stage it into acute and chronic. And they talk more about the histological features than anything else. And that's all we're going to say about that. So it's very detailed and there's a lot more to know. If you want to look at the National Cancer Institute website, there's tons of information. So just we're just touching on it, and then we will, if you need to, if you start working in cancer treatment, you'll get additional education.